Meanwhile, COVID cases in Thailand top 1 million. The details are from Veronica Carino joining us live. Hi, Veronica.
Yes, hello, Crystal. Good afternoon. Thailand surpassed 1 million mark of COVID-19 cases since the pandemic started last year. As of today, there are 19,851 new cases and 240 fatalities, according to the Public Health Ministry. There were 19,526 cases in the general population and 325 cases among inmates in prison. In the last 24 hours, 20,478 COVID-19 patients have recovered and have been released from hospitals. There have been 1,009,710 COVID-19 cases since the pandemic began early last year, with 795,805 of them recovering. The death toll from the third wave was 8,732 and 8,826 since the pandemic began early last year. In a related news, according to the Department of Medical Sciences, combining Sinovac and AstraZeneca vaccines has shown high efficacy in dealing with Delta variant of the coronavirus. Dr. Supakit Sirilak, the department's chief, stated yesterday that a Sinovac and AstraZeneca combination was the best option under the current circumstances of accelerating immunity. He referred to laboratory test results from a study conducted in collaboration with Sirilak Hospital. Dr. Supakit stated that blood samples from 125 participants aged 18 to 60 years who received a Sinovac shot and then an AstraZeneca jab revealed a quantitative level of body immunity of 716 compared to 117 of a full course of Sinovac and 207 of 2 AstraZeneca shots. The laboratory test shows that the combination of Sinovac and AstraZeneca is correct. However, the test has not yet answered our question about the duration of efficacy, so more research is required to determine when we should receive the booster dose, he stated. He insisted that mixing vaccines resulted in a higher level of antibody, as suggested by the National Communicable Disease Board, but that less time was spent creating the antibody. The second dose of AstraZeneca will be administered 3 weeks after the first Sinovac shot. After receiving both doses, the immunity level will be increased in just 2 weeks. Typically, the Ministry of Public Health recommends waiting 8 to 12 weeks before receiving the second shot of AstraZeneca. The side effects of the combined vaccine are nothing to be concerned about because they are no different than getting the AstraZeneca vaccine, he said. He also stated that the department will collect information on people who received the Pfizer vaccine for further study, with the result expected in about a month. Pfizer's mRNA-based vaccine has been administered to at least 300,000 people. The department intends to conduct a study of antibody levels when the vaccine is administered through the skin rather than into the muscle, as it is currently done. It claims that if a small amount of vaccine can be administered through the skin, 4 to 5 times as much vaccine can be administered to more people. If the results are the same, they may be a significant change in the vaccine management. This update is from Bangkok Post. Back to you, Crystal.